So I'm Michael Ash, I'm the Chief Executive of the Volunteer Centre for Kensington and Chelsea, and we're here in the drop-in room of our offices under the Westway at One Thought Close. It's an amazing privilege to work in Kensington and Chelsea, partly because so many other areas of the country don't have the resources that we do locally, but also because we don't have the people in the rest of the country that we have in Kensington and Chelsea. And it's been a real journey since the fire in 2017 when I arrived, trying to work closely with the council, the NHS, but most particularly with local people to make change. The council seems to be committed to participation, to involving its residents in all that it does, but it's patchy. We've done a really wide range of work, helping residents to understand how the mental health system works and helping officers of the council and the NHS to understand how it should work in the future. So during the pandemic, we're really proud of the fact that the voluntary sector and local residents led the efforts to think and react to the pandemic. So we brought in the local council and the NHS to our space in order to plan together. And that's led on into the work we're doing now on cost of living crisis, trying to help people close the gap between incomes and costs, particularly for the poorest people in the borough. And it's been a very inspiring journey. It's not always been easy, but it's been great to be able to bring together people from a wide range of backgrounds and skill sets to work practically to address the priorities of the community itself. The work that we've been doing recently with the customer delivery team at the council, working with a group of residents over 6 sessions in the evenings, looking at what their expectations of the council are, how close those expectations are to the reality of their experience over a long period of time. It's been really insightful to hear from residents that gap between expectation and delivery, and to hear that the things that you might expect are important, like how quickly the telephone is answered or how polite people are on the phone, is much less important to most residents than feeling that they are listened to, that their problem is valued and is important to the person they speak to, that there's a good chance that they will see action to follow up on their inquiry, and that the person that they're engaged with on the phone, by email, maybe in person, cares about what happens to them. We're hoping that the council is going to change gradually from seeing itself as a primary deliverer of services and a decider of priorities to being a facilitator, to helping the community across the borough, local residents, work with each other to decide on their priorities, to work out how to plan to respond to them, and to deliver services directly themselves. And we want to see that change and shift towards a more community-led model.